Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Thank you for joining me today. We are going to discuss an essential aspect of dental practice, managing medical problems, particularly pulmonary issues in dentistry. In this video, we will focus on asthma and chronic obstructive pulmonary disease. Understanding and addressing conditions like asthma and chronic obstructive pulmonary disease is crucial in dental practice. Uh, Proper management involves knowing the patient's medical history, identifying potential triggers, and being aware of their current treatments. Dental professionals need to adjust procedures as necessary and have an emergency plans ready. When managing patients with asthma, it is essential to differentiate true asthma from other respiratory issues like allergic rhinitis. True asthma involves episodes of airway narrowing, causing wheezing and breathing difficulty. Key factors to consider include what triggers attack, how often and severe they are, and the patient's medications and treatment responses. Ask patient about their asthma triggers, attack frequency and severity, and medication use. Check their history of emergency rooms visits or hospital stays to understand the severity. Additionally, identifying any non-steroidal anti-inflammatory allergies is crucial, especially for patients with Samter's triad, as this can influence dental treatment plans. Patient with severe asthma might use various medications, including bronchodilators, inhaled corticosteroids, and systemic corticosteroids. Cromolyn sodium can prevent attacks but is not effective during an active attack. Inhaled beta adrenergic agonists like albuterol are used for quick relief during asthma episodes. Dental practitioners should be aware of these medications and their implications for dental care. Managing anxiety is key as it can trigger asthma attacks. Postpone elective surgery if the patient has a respiratory infection or is wheezing. For major surgeries, consult the patient physician about possibly increase corticosteroids doses to prevent adrenal insufficiency in patients on long-term steroid therapy. It is essential to have the patient's bronchodilator inhaler available during dental procedures. Keep emergency drugs like injectable epinephrine, theophylline, and inhaled beta agonist on hand. Avoid non-steroidal anti-inflammatory drugs in patients prone to asthma attack as these can worsen their condition. This box shows the management of the patient with asthma. Let's have a look on chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease includes conditions like emphysema and chronic bronchitis, often caused by long-term exposure to irritants such as tobacco smoke. Symptoms include breathing difficulty, a chronic cough with thick mucus, frequent respiratory infections, and a barrel-shaped chest. Severe cases can lead to pulmonary hypertension and right-sided heart failure. Patients with chronic obstructive disease typically use bronchodilators like theophylline, beta agonist, and anticholinergics. Inhaled or systemic corticosteroids may be needed for severe cases. Supplemental oxygen is used in most severe cases. Knowing these treatments helps dental professionals provide safe care and anticipate potential complications. Consider corticosteroid supplementations before major surgery for patient on long-term steroid therapy. Avoid respiratory depressants like sedative, hypnotics, and narcotics that depress respiration. Uh, Position patients upright to manage their pulmonary secretions effectively and ensures a safer and more comfortable dental practice. Continue prescribed oxygen therapy during dental procedures and consult with the patient's physician before changing the flow rate. Avoid high concentration of supplemental oxygen because high concentration of supplemental oxygen can suppress respiratory drive in chronic obstructive pulmonary disease patients, leading to potential respiratory failure. Monitor respiratory and heart rates closely during treatment to ensure patient safety. This box shows the management of a patient with chronic obstructive pulmonary disease. In summary, managing dental patients with pulmonary conditions like asthma and chronic obstructive pulmonary disease requires a thorough understanding of their medical history and current treatments. Proper assessment, anxiety management, and emergency preparedness are the key. Collaboration with the patient's physician is often necessary to optimize treatment and ensure patient safety throughout our dental procedure. Thank you. Wish you best of luck.